this episode of the Moss Report Around the World, we visit Oasis of Hope in Tijuana, Mexico, and we speak with Daniel Kennedy, Dr. Contreras, and Rosa Contreras.
We're so honored to have you here. I remember in the 90s a visit from your dad, and it was such a warm visit. And we're going to go now and walk some of the halls that we walked with your father.
Let's go check it out. The following segment is an edited version of the full clinic conversation available at themossreport.com.
Dr. Moss, so good to see you.
And Dr. Contreras, great to see you.
Well, it's been a long time, but I've of course, we continue to follow your report and your writings. It's always very interesting, and I think that you keep us all up to date.
Well, thank you. I feel a certain bond with you and with your family because of the fact that I knew Ernesto, your father, and there aren't probably not that many people left who knew him and remember him. And he was my first introduction to the living world of alternative medicine. In other words, I knew about alternative cancer treatments from reading and from the other side, from looking at it from the Sloan Kettering side when I was employed there. But they made the mistake of sending me down to Anaheim, California in 1976. I was doing public relations for Memorial Sloan Kettering, and the president of Sloan Kettering, Robert A. Good, was speaking at this big scientific meeting called FASEB. It's a big biology meeting. And on my own, I had a friend of mine drive me down to Tijuana just on my own to investigate, because I was so curious and was, after all, involved in the writing about cancer already from 74 onward. So I just dropped in at the clinic, and without announcing myself, without saying who I was, just I was a North American from New York and was interested. And he actually, without using the Sloan Kettering name, he actually invited me in, and we had a conversation at that time for about an hour, I would say. And this was a great thing, great moment for me. The biggest thing was that, and I don't want to spend the time talking about myself, but I'll just lead in as an introduction, that the way that he was depicted in the media in the United States, the mainstream media, was not always very favorable. Correct. And sometimes he was almost demonized because some people just had to squeeze this phenomenon into a box that it didn't really fit into, because it was a much more complex, as you know, question of what all that was going on. 70,000 people from the U.S. came over the border to Mexico in the 70s to be treated with what we would now call complementary medicine.
Hmm.
And he was at the center of that. And I knew him a little bit from that he had come to Sloan Kettering under the invitation of Lloyd J. Old, who was at that time vice president of Sloan Kettering. So I knew that there were people within the establishment who took at least a friendly view towards what he was doing. I don't want to say favorable, but they were open-minded
Correct.
towards what he was doing. So that was my first introduction, and it was a complete disconnect between how he was depicted sometimes in the media and the person that I met, because the person that I met was a lovely person. He was he was musical. He was prayerful. He was obviously caring. I went around interviewing people again without anybody's permission, but I just went around and talked to the patients, most of whom were U.S. people, and they were very happy to be there. I mean, to put it mildly, they felt like refugees uh,
Hmm.
from this machine-like system in the U.S. to a very personalized treatment. So I'm not passing judgment. I wasn't passing judgment then or now on the efficacy of the treatment, but I could see immediately that there was a qualitative difference between what they were getting at that time and what they were getting at the what's now Oasis of Hope. So it has a place in my heart. The involvement and the understanding of this. It was a big moment for me.
Well, thank you for sharing that story. It's beautiful to hear and to remember my dad
Yes,
in those ways.
yes. I'm sure he would be amazed, as we all are, at what has happened in oncology, good and bad.
Hmm.
But where does Oasis of Hope stand? Where do you stand vis-a-vis, the modern situation in oncology? And how do you approach a patient who may be in dire straits, maybe has no good options from their point of view in another country or even in your own country? How do you approach serious cancers, advanced cancers?
Well, the philosophy of body, mind, and spirit has not changed, but the tools that we have available today have, and many of them to the benefit of the patient. I think that one of the greatest advances in the integrative approach is the fact that for the last 15 years, no more chemotherapy or new chemotherapies have been developed, and
Right.
new targeted therapies that are somewhat effective.
Hmm.
Um, uh, Used alone or in combination with chemotherapy, um, have opened some doors, but especially the targeted immune therapy on the conventional side, in combination with our therapies, have proven to be very, very effective and very helpful to the patient. So, as far as integration, I think that is good. The new machines for radiation therapy that have proven to be quite effective and a lot less damaging to normal tissue or healthy tissue,
Hmm.
has also proven to be very effective, and so we can combine those with our approach. And on the alternative side, well, the use of high dose of vitamin C, hyperthermia, um, have proven to be quite effective in helping a lot more patients survive based on very scientific data from the states on dendritic cell vaccines, and hopefully in the near future CAR T cells that is not going to be so terribly expensive as it
Yeah.
is in America,
Yeah.
are things that we are on our toolbox and that we are using very effectively. CAR T cells, not yet, but dendritic cell vaccines, TILs, tumor infiltrating lymphocytes, lymphokine activated lymphocytes, have proven to be very, very effective. And our percentage patients that we're able to help now in comparison to, let's say, 60 years ago. In my dad's time, about 25% of people that we could help. And now it's about 40% because of all of the new things that we have added to our protocol.
Mhm.
And so I'm very happy for all of these new things that are coming. Very excited about the fact that more and more researchers are looking into alternatives in a different way. You know, when you came to see my dad, we were quacks, and now we're alternative doctors. I think that's a big improvement.
Yeah.
And so we are very hopeful about the future, and how we can better help cancer patients that have not responded or that do not want conventional therapy. So we are very, very happy for the new things that are coming up, and I think more are going to be here.
So the lines have been blurred between what's conventional and what's alternative, because when I visited the first time with your father, uh, hyperthermia was on the quack list, and immunotherapy in the form of Coley's toxins and some other things were on the quack list, American Cancer Society. So now this is immunotherapy is the officially recognized fourth modality in cancer. So in a way, I'll put it to you in a kind of challenging way, that many patients no longer have to go to Mexico to get immunotherapy, because even if you were a pioneer and your clinic was a pioneer in doing that and promoting that, now it's guideline medicine to treat some kinds of cancer first with immunotherapy. Sometimes chemotherapy is even off the table. And certainly with the targeted drugs, which are a kind of immunotherapy, different kind of immunotherapy, um, they're so prominent in the treatment. So is it just historical that Oasis um, offered or still offers this, or do you have a way of doing immunotherapy that's somehow superior to what would be available back in Wichita or Toledo, Ohio, for the U.S. patients?
Yeah, it's a big difference. I think that if you look at the stats with checkpoint inhibitors, for instance,
Uh-huh.
it prolongs the life of patients 3 or 4 months.
Yeah,
But when we're able to combine them with our immunotherapy and the rest of our therapies that we've been doing for many, many years,
yeah,
then the improvement of the patient goes to years, not just a few months. So I think that we still have a lot to offer in comparison to using these new modalities, targeted therapies, by on their own. And the obviously the target is that when we get all of the mutations and we have targeted therapies for all of the mutations, then we'll be able to cure cancer. There's no question about that. The problem is the cost.
hmm
Patients are going to be needing 75 or 100 targeted therapies to cure their cancers at $10,000 a month. Well, that's going to be just about impossible for anyone to be able to do that. But I feel that in combination with the therapies that we do, a couple of those targeted therapies, in our experience, will make a big, big difference in the outcome. So we still have a lot to offer. And I'm going to be very happy when everybody in the world is doing the same thing and we're getting the best treatment for patients
yeah,
possible.
right.
So until that time comes, I think that we still have a lot to offer.
And what sort of cancers have you had the most success with?
Well, cancer of the lung continues to be one of the best. Breast cancer is where we have the most patients come to us
Mhm.
with very, very good long-term results, especially when a patient has not received chemotherapy or radiation therapy. Our
Yeah.
5-year survival rate in stage 4 breast cancer is about 75%. It's just through the roof. And even when patients come here after having received chemotherapy and radiation, our 5-year survival rate is 50% in comparison to about 30% with just conventional therapy. Cancer of the colon is also another one where our long-term survivors are about twice the ones reported with conventional therapy. Ovarian cancer is about 3 times better than with conventional therapy.
And so, what about your hypothermia?
We have a whole department for hyperthermia,
Uh-huh.
and we've been able to develop it much better than most places in the world, even than Germany. And so it's a big part of our program.
The last time I was at Oasis of Hope, one thing that stands out for me was the outstanding food that you serve. It's like you grow a lot of your own food, don't you?
Yes, we have a garden here, and we produce probably about 65-70% of all the vegetables, and they're truly organic because we control that. So that's a major part. It's been great talking to you.
It's great.
Very happy to see you, and I wish you well. God bless you.
Thank you. Great seeing you. You look
Thank you very
great,
much.
and it's really great to reconnect with you again.
Thank you very much.
I was saying how I remember from my last visit to the hospital how outstanding the food was, and
Yes.
and I think the family gets to eat in the cafeteria too, don't they?
Yes, they do. They get to eat here with us
Yeah.
and with the patient. And definitely, it's a big part of the treatment. So, yes. And yeah, our food is pretty good. We've implemented a lot of new recipes, um, just new because of the garden now, we can grow the things that we want to give our patients. So, it has definitely changed, but for the better in a good way.
Do you still have a garden on the roof of the
Yes, we
building?
do.
That's good. And so I understand you're being sort of groomed for taking over some of your father's responsibilities.
Hmm.
Is
Hmm.
that true?
That is true. Very exciting. Yes, very exciting with a
Wonderful.
great team, a great team. So,
Yeah.
yes.
Well, it's nice to meet you. I'm sure we'll meet in person.
Yes,
Yeah.
that would be great. Nice meeting you.
Yeah.
Such an honor too.
Thank you.
The use of supplements and diet as almost a primary protocol in order to be able to facilitate the effectiveness of all of the rest of these integrative care options that they have. I mean, I understand it has been a part of
Yes,
the care
definitely.
here,
Definitely.
but maybe if it's changing, in what way?
Yes, definitely. It changed a lot. My grandpa was very big about, your diet and the foods that you were eating. But I think as the years have gone by and the more that we've learned and then, new generations come, I think it became more of it goes hand in hand. So a lot of patients before used to come maybe and were kind of interested in part of the nutrition, but they didn't have to do a lot of it or they didn't think it was that important. And I think now our approach is very as in they go together. So it's part of the protocol. So it's not just something that we recommend. It's something that, is integrated into our protocols that we do here. So it's very, very important. The other thing is that yes, Daniel, my grandpa, and my dad had always wanted to do a garden here, and it was a vision that they had had. And I am so glad that we were able to do it now because a lot of the foods that we think are very important, cruciferous vegetables and things like that. Now we grow them. We make sure that they are organic, and then we feed them to our patients. So that's just amazing. And they get to see the garden. Sometimes in classes, they get to be part of us, taking, part of, some fruits or vegetables out and then us cooking together. So teaching them that. So that's another thing that we've done too. It's not just you come here and you have great food, but you also come here and you learn how to cook and you learn with us, juicing, smoothies, making sauces. And so you have the cooking class and you go back home and you're not just thinking, I don't know how to do this. You're like, okay, I kind of saw this. I'm kind of familiar now. So the nutrition talks plus the cooking really empowers them to feel like I can go home and continue. Because it's very easy when you come here and we are giving you food and, it looks nice and I didn't have to cook it. But what we want is for you to, continue this lifestyle for a long time. And if it can, forever, not just like a 3-week diet.
Mm-hmm.
Mm-hmm.
For the full unedited interview of Dr. Contreras and Rosa Contreras, please visit themossreport.com. We're very, very honored to have been able to meet the folks here at Oasis of Hope. They've treated us so kindly, and Daniel, I want to thank you very much for helping to coordinate our trip and for taking us on the lovely tour and introducing us to your world here. It's been a fascinating visit, and we appreciate the look into the program here at the Oasis of Hope, and thank you.
Thank you so much for the visit, and please give a big hug to Dr. Moss.
I will. For the Moss Report, I'm Ben Moss. How are you healing today?